Just give us your position. Why do your ambulance workers feel the need to strike?
Well, look, so we've got the first day of action by Unite the Union today, and as you say, a further day on Monday. That follows 2 days of industrial action in the last couple of weeks by GMB here in Wales and obviously across the rest of the ambulance sector in the UK too. The staff I've been talking to in the last few weeks are saying to me that, you know, they joined the ambulance service like I did to help people, to provide great care to patients when they need us most. And in the choices that our staff are making, our people are making, they feel deeply conflicted because on the one hand, they joined to provide that great care to patients when they need it most, but on the other, they feel that they can't currently do that because of the pressure across health and social care, and they feel that the time is now right for them to make their stance, you know, their point with their unions about the pressure and the working conditions which they are currently enduring. But of course, you know, the dispute arises out of one of pay, which is with government, not with me or with us as the employer. But of course, these issues, these workplace issues, are very much in the minds of our clinicians and our control room staff in the choices they're making.
So do you very much feel that these employees, these workers, these beloved part of our country, our community, we rely on these workers enormously, that they feel that they genuinely have no option, that they've thought long and hard about this and it's not been an easy decision to make, but we really have hit the precipice now and something has to be done?
Well, look, there's no doubt in the staff that I've been talking to in the last few weeks that many of them feel now that the pressure is such that they can't do the job that they joined for. They can't provide the great care that they want to offer to patients when they call us, when they need us most. Often our paramedics and emergency medical technicians, you know, are seeing 1 or 2 patients in a 12-hour shift now, where, of course, you know, pre-pandemic and prior to the pressure being at the extent it is, that was 6, 8 or 10 patients a shift. They're concerned about the impact on patients and patient safety. And of course, we do know that some patients, sadly, are coming to avoidable harm as a result of the delays that are occurring. Now, it's a complex picture. Delays at the emergency department happen, which hold our crews there and prohibit us from responding in the community. Those delays happen because of flow through the hospital not being as efficient as it should be, and that's because there are many patients in beds that are medically fit for discharge that could be in communities but can't be because of pressure in adult social care. So this is a kind of multi-sector issue, but our ambulance staff, certainly our ambulance workers, paramedics, call centre staff and others do feel very strongly now that they think they need to make the point to government and others that the pressure is such, their working conditions are such that they feel they need to take strike action.
Jason, how bad was it before the COVID disruption, and how much of an impact has that had on the service that can be provided now?
Well, look, I mean, COVID is certainly an issue, and it does remain with us. I mean, if I just give you 2 examples. So in December, just gone, we lost 32,000 hours of emergency ambulance capacity here in Wales. So that it was about 38% of the entire fleet for the month unavailable to us. In 2018, so well before the pandemic, that was just about 6,000 hours a month. So these are the emergency department delays and the impact it has on our fleet nationally and our ability to respond. So there is no doubt that things are worse now after the pandemic than they were before we went into the pandemic. But the pressure that we've got now is not solely as a result of the pandemic and COVID.
We're seeing lots of stories in the media, actually. I interviewed one lady earlier this week. Terribly sad. Leslie Weekly was her name, and her husband, Rob, lost his life because they were waiting for an ambulance for 90 minutes and he couldn't be saved. She isn't a one-off. We're seeing these in the press every day now. Do you think that's going to lose support from the public? We're scared, actually, to be frank. We're very scared that something's going to happen to us or our loved ones.
Well, look, firstly, I need to apologise to all the patients here in Wales that have waited longer than we would like for their emergency ambulance. I see many of those cases personally in terms of the concerns and the complaints that are raised. So I am aware of the impact of these delays. It's clearly not the service that we want to be providing, and it's not the service that our clinicians and all of our staff want to be providing either. The delays occur because of pressure around us. Now, here in the Welsh Ambulance Service, we've invested heavily over the last 3 years, grown the organisation in patient-facing roles by about 400 posts. We've changed our roster system and made other efficiencies, so we're working as efficiently and effectively as we can. But as fast as we're creating those efficiencies and that extra capacity, it's being lost at the emergency department because of the pressure around us. So I think these delays are here for a little while yet, because these are complex issues that the whole system, health and social care system, does need to work together on to fix with support of government. But in the meantime, we will always prioritise our response to the sickest patients first, and those that are immediately life threatened will always get a response from us.